After black and brown Georgians went to the polls in record numbers in 2020 and on January 5th, 2021, evil forces in the Georgia legislature passed laws to make it harder for poor people to vote. They know that racism has nurtured poverty in our communities. They also know that if we vote, we have the capacity to make change. Show them that we will not bow down to racial oppression. Vote. It is your right, your privilege, and your responsibility.
Hey, this is Don D.C. Craddock from Mix 106 Radio in Atlanta, NAACP. I'm out here in the community, Cleveland Avenue Barbershop today, talking to everybody over in District 12 in the city of Atlanta about getting this vote out. We're setting records each and every day, but I want to hear from the people on the street. Y'all come follow us as we talk to all the people that we can out here about getting out this vote. And then while you're waiting, go over to the website, AtlantaNAACP.org, and get in the fight and join us in doing this work. Let's go get this vote out, people. I want to know, like you look around Cleveland Avenue, you grew up over here? All right, what can we do to create safer place to live, and also create jobs for people to own their own shops like the Cleveland Avenue Barbershop, or to own stores that we don't see in our community? What more can we do on that part, Cleveland?
I believe we need more consistency.
Okay.
Consistency, independency. I think we just need more people willing to get up, you know, and say, I'm finna go do this today, but not just today. I'm gonna keep on doing it and keep on doing it until I got enough to better myself or just better my community. I think we got a lot of abandoned apartments and business around here. We could work on that. You feel me? A lot of people get money, they don't try to invest in their hood or where they from. They go take it other side of town and don't never look back. So I believe we can invest in that. And
so is there hope? Is there any hope that we can do better in this area?
Oh, for sure.
Cleveland Avenue?
Yes, for sure. I believe it's a lot of hope. Like, if we don't got nothing else, we got hope.
The hope is in the youth.
It's in you young people,
yeah,
right,
to do it. I want to thank y'all for your time, brothers. Let's go and win together, okay? Sure. And the way we do that is we harness the power that's within us, and that's the power to vote. That's the power to organize and strategize so that we can win each and every day. Y'all agree? Yeah. Well, let's do it on Cleveland, baby. How much power is the vote in your opinion?
The vote is the only thing that makes us all equal. One vote, one voice, that's it. No matter how much money you got, how much influence you got, you have one vote.
And having that power of the vote, what could that change in this community, all that live over here?
It could change everything. I mean, the vote has the power to change everything. It's been proven. We've seen it. You know, we voted and we got the Civil Rights Act. We voted and we got rid of Plessy versus Ferguson. We voted and here we are, you know. And I believe the local votes, the local elections are most important. The votes for superintendent and for your school district, most of your property taxes are for the school district. The school district is one of the main things that drives value into your property. We have to vote for that.
I got to ask you this. Are you a registered voter, if you don't mind me asking?
Yes, I am, sir.
Are you an active voter?
Yes, sir, I am, sir.
What would you encourage young black males and young people in this community to do when it comes to their vote?
This is my encouragement, and I'm that victim too. We vote on what we thought was important, which was the presidential election. We thought when we got the president in, which we didn't realize that the local elections were the elections that was going to affect us the most. Just like the young man said before me, your schooling, who's going to be your superintendent, who's going to be your police chief, who's going to be the mayor. All the small, what we think is the local elections are the ones that influence us. Just like right now, because we did have a president that gave us more education than we could have ever imagined. You know, Mr. Trump educated us. We never watched CNN that much in our lives. We didn't understand the Senate. We learned about the Senate. We now can take back what we said about Barack Obama because we believed he wasn't doing anything. Without the Senate letting it through, you can't do anything. Now, for the first time, we have the Senate. That's why Warnock is important to us to keep the Senate control. See, these things we did not know. We thought the president did everything. But with that education now, we are more, politically more literate than we were before.
I got Ray McClendon in here. He is our political action leader for Atlanta NAACP. Ray, what does it look like our first week of early voting?
Well, we're excited, and because people are motivated, they're energized. They are not buying into the misinformation and the disinformation. They know how important this election is, and we're just so happy to see more and more of our brothers and sisters recognize how important this election is because health care is on the ballot. Indeed, Medicaid, Medicare are on the ballot. Yes, people are talking about issues each and every day that affect your daily life, and your life depends on whether or not you get out and vote.
Hey, yesterday you were out and about across Atlanta. The Atlanta NAACP, along with the Georgia NAACP, was partying to the polls. So how did it look to you yesterday?
It looked great yesterday. We saw a steady stream of voters taking up their right and expressing their voices across the city. And so we're excited about that, indeed across the state, to see more and more people recognizing to take advantage of early voting. You know, there's so many folks that are trying to come against us. The opposition has tried to use SB 202, the voter suppression law, and come up with all of these ways and obstacles of keeping us from voting. One of the ways to deal with that is to get out and early vote so that if your vote has been challenged, if there's a change in your polling location, you don't have to worry about that during early voting. You can get out early and vote, and that gives you an opportunity, if there is an issue, for you to cure that problem in time for your voice to be heard in the election. If you wait till November 8th and a challenge comes up, you might not make it. So get out and early vote. We still have today, next weekend, up through November 4th to early vote. We look at November 8th as being the last day to vote. That's not election day. Election day is today. Right. Today is election day. Tomorrow is election day. Let's get out and vote early and put those votes in the bank in order to ensure our democracy.
Yesterday, at Morehouse College, their homecoming, and by the way, they won yesterday. Those young men had on shirts saying, "Black men will show up and vote."
Black men are showing up and voting. Black men have now recognized that their voices are important. In other words, they wouldn't be trying to keep us from voting and try to slow us down from voting if people didn't recognize how important our vote is. 750,000 black men didn't vote in the primary, but we want to make sure they come out and vote now, because if even half of those brothers who didn't vote in the primary vote right now, we can change.
Good morning. I'm Richard Rose, president of the Atlanta NAACP. We're here this morning to talk about the health crisis that's facing not only the city of Atlanta and Metro Atlanta, but Georgia in general. Our other partners in this initiative are Georgia Stand Up, headed by Deborah Scott. She's out of town, and Helen Butler, Georgia Coalition for the People's Agenda, who is ill this morning. We're also joined by Sandra Williams with the North Georgia Labor Council. But I will bring to you first the Georgia State Conference President of the NAACP, Gerald Griggs.
Thank you.
Thank you, Richard. And it's unfortunate that we have to come together this morning on such an occasion to talk about the crisis of healthcare in Georgia, but more specifically in the metro Atlanta area. As we heard, the Atlanta Medical Center, also known as Georgia Baptist, will be closing, and also South Fulton Hospital will be closing as well. And it really pushes the crisis of healthcare in underserved communities to the top of our conversation piece. You know, as the president of the Georgia State Conference, I've seen hospitals close across the state because of lack of funding. And it's time for us to have a real conversation about what healthcare disparities look like in underserved communities. So we are standing here joined with our coalition to push for more access to affordable healthcare, for more funding in rural hospitals and urban hospitals, because it should not be a choice between where you get your care or where you're going to live. And so, you know, as this crisis has affected all of Georgia, we at the Georgia NAACP are calling on our elected officials across both party lines to solve this issue. It should not have to come to our doorsteps before an election for it to become an issue. And so we at the Georgia NAACP stand shoulder to shoulder with all 180 units, but particularly with the Atlanta NAACP today, to demand full funding of our healthcare systems. We have had conversations with Wellstar about a process to make sure that our hospitals don't become overcrowded, that there is care for all of our communities, but we need help from our elected officials, whether that's local officials or state officials, because this just didn't start yesterday. This has been a reoccurring issue for the last years throughout Georgia. When the rural hospitals were closing, we stood up. Now the urban hospitals are closing, and we need a solution that speaks to care for underserved communities, that speaks to care for our minority communities, but speaks to care for all Georgians. So again, we stand here in solidarity and in coalition with our coalition partners, asking our elected officials, what are you going to do about the crisis of coverage in Georgia? This is not a partisan issue. This is a care and compassion issue. This is a funding issue. This is a people issue. And we demand change. We demand full funding. And we demand assistance now. I'm Attorney Gerald Griggs, president of the Georgia State Conference. And we demand healthcare equity right now.
Good morning. I am Sandra Lee Williams. I am Deputy Political Director for the Retail Wholesale Department Store Union, board member of both the NAACP, Cherokee County, Georgia, as well as the Atlanta Labor Council. I am happy to be here to speak on behalf of essential workers. We know that this is a critical time in our history and in this country, but particularly in Georgia. We know when our governor, our current governor, refused Medicaid expansion, what impact that would have on our healthcare system. And it has happened. In rural communities across this state, we've seen hospital closures. In this urban area, most recently with the Atlanta Medical Center, we see hospital closures. But I want you to think beyond the hospital closure into those families, those women that support families, those men that support families that worked in that hospital. We had one person in the news that we just saw that he had worked at that hospital for 50 years. And he stood there and with his coworkers to say many of them he would never see again. He went into retirement. But we have a number of younger workers there that will not be able to go into retirement. They work and live in the community with which that hospital served. What about those families? We had a woman that worked in the hospital stand before us and tell us, we just got notice when this has been a plan in the works for several months. We know hospitals don't just decide to close within a 30-day period. Why keep your employees blind to the fact that you refuse to serve their community, and now they are without jobs? Many of them unable to transfer because they have no transportation, which puts them in jeopardy, puts their families in jeopardy. So I'm here asking for both the state government, municipal government, to stand together with us in coalition to find a solution. We know we have a population of homeless people right here before us. All people deserve the right for care. We know the indigent care will always be with us, but we have the funds here in this state to do something about it, and we refuse under the current administration. Justice must be served, and we have to serve the will of the people. Thank you.
Thank you, Sandra. Gerald. Great hospital systems require public support. That's nothing new. They do it in Texas at MD Anderson. They do it in Minnesota. Our state leadership has abdicated its responsibility for public health. 14 hospitals have closed in the last 20 years. 6 in the last 3.5 years. There is a cry for help. Georgia remains, seems like committed to being at the bottom of health care, at the bottom of education, at the bottom of wages. We need a commitment from state leadership to invest instead of proposing to send back tax refunds and rebates. Let's invest in the people of Georgia who need these health systems to be operating. The lack of bed space will impact all of us, those of us with insurance as well as without insurance. When there are not enough beds there available, somebody gets to make the decision who will occupy this bed, who will get the treatment they need. And then with regard to people of color, we already know what racial disparities have done to our economic base. Now we're being again punished because of the deeds of the past. It is time for us to call on all of those people in leadership to make a real commitment to serving the people, to serve the voters. That is not what we have now. Wellstar has announced new cuts at the South Fulton facility, shuttering off those services to a private group. Over and over again, even though Wellstar has significant public support, they don't pay federal or state income taxes, they don't pay property taxes. Where is their commitment to the people? Where is their commitment to the public? And we call on Georgia's leadership, where is your commitment? Where is your concern about the least of these? Time out. We call, as Gerald and Sandra said, this is not a Democrat versus Republican issue. We need these leaderships, committees, these leadership forces to stand together and work together. Great hospital systems require public support. We need public support for the hospital systems all over this state. We take any questions that you might have.
Thank
I will say this. There are certain politicians that like to talk about Georgia being the #1 place for business. But if Georgia does not provide for the healthcare services of its citizens, how long will Georgia be the #1 place for business? Georgia needs to be the #1 place for Georgia citizens. That means healthcare accommodations. That means equitable living conditions. That means true care and compassion. So when Georgia becomes #1 for compassion, then we will rejoice. But right now, Georgia has a healthcare equity issue. It has a services issue, and it's not only in Metro Atlanta, but all over the state. So we are calling on our elected officials to do more than talk, to actually provide resources for Georgians to make sure their care is taken care of, to make sure that they have bed space available at Level 1 trauma centers, to make sure that Georgians don't have to go to Alabama or South Carolina or even Florida to get quality health care. So if Georgia wants to say it's #1, let's actually prove it by funding our healthcare system. Thank you.
And Wellstar is announced they're investing $30 million in a new headquarters. where is their commitment? Where is their compassion to the people that they already have committed to serve? We think that's an abomination. There are so many healthcare disparities, including neonatal facilities. There will be now 4 Level 1 trauma centers in all of the state of Georgia, serving 11 million people. New York City has about 5 million people with 19 Level 1 trauma centers. As Gerald has said, when is Georgia going to try to really live up to its claim that it is a #1 place to do business? What about a #1 place to live? Georgia's minimum wage is less than $6 an hour. When do the people start to count? We ask you. We call on state leadership to make a real commitment. Let's work together with nonprofit entities, with these hospitals, with these counties. Let's serve Georgia's people from Chatsworth to St. Mary's, all over this state. We all deserve quality access to quality health care.
I got one question. I guess the message is to elected leaders, but also to Wellstar itself. But is it too little too late because we're now 1 week away? Is there anything they can do, or anyone can do short term to help? We only got 1 more week.
We only have 1 more week. We have had a conversation with Wellstar. They claim to be working with several parties to try to alleviate this problem, but it's a long-term effect of neglect. And so now we're asking for a long-term commitment to serve all of the people of Georgia so that we won't continue to have these hospital closing, leaving people without access to health care. For strokes and heart attacks, time to get to medical health, medical professionals is absolutely important. It's essential for people to maintain life and maintain quality health. So continue to change to close these hospitals south of I-20 is an abomination.
And just to speak on that, the need for urgency, with 1 week left, we need all parties to come to the table to talk about real solutions that we can do in the short term and also map out a long-term strategy. So what we're calling on behalf of the NAACP is a meeting with all parties concerned. We've already met with Wellstar. At this point, we need to sit down with the other hospitals as well as our elected officials and talk about a plan forward. The community should not have been the last individuals to know about this. And so now that we're engaged and involved, it's time for our elected officials to come to the table and let's come up with a long-term strategy of how we fix this and a short-term stopgap. You know, Wellstar is talking about it's in communication with other hospitals. The community needs to be in partnership with those other hospitals to talk about the solutions. So that's what we're calling on. We're calling on a short-term meeting to talk about short-term solutions and a long-term strategy that includes the voice of the citizens because they will be the most affected.
And everything should be on the table. Even maybe a $0.25 sales tax that goes into a health care fund for the entire state of Georgia. We have to stop relying on what we have done in the past that have not worked for all of the people. Let's come up with solutions that will solve these problems long term for every Georgian from Tennessee to Florida. Let's solve these problems permanently so that we don't have to keep coming back talking about another closure of a needed health facility in urban and rural communities.
Yeah, my only comment again goes back to what we do with the essential workers that work at that hospital and for the community that it serves. With the funding that was received from the governor to go to Grady Hospital, we're still short 200 beds. Richard spoke about the maternal child health. Georgia has one of the lowest rates when it comes to maternal health. Yet we just closed a hospital that served women that are pregnant and women that need maternal health care. We need to have a community conversation with the hospitals here in Atlanta because it's Atlanta Medical Center today, but who is to say it's not another hospital service center tomorrow? So we must have these conversations. We know that we have the financial stability in this state to make a difference. And someone asked, I think it was you, Steve, that said, do we have time within the next week to do something? Anything can be done in a day's time if all the powers come together to make a difference and to make a change for the betterment of our community.
And, you know, there's one last conversation that needs to be had. You know, with the closing of Atlanta Medical Center, there becomes a gap in services, but also an opportunity. You know, Georgia has a very serious mental health crisis going on right now. And now we have a potential facility that can be repurposed to address that. These are ideas that will come to the table if you invite the community into conversation. You know, when we talk about the largest provider of mental health services in Fulton County and most of the Southeast is the Rice Street Detention Center. Well, now there's a piece of property right off of Boulevard that we can repurpose. These are conversations that need to happen, and they need to happen right now. So again, to answer your question, Steve, there needs to be a meeting before next week to determine what the citizens of Atlanta, what the citizens of Georgia want out of their medical facilities and what they want out of their healthcare systems. It's incumbent upon elected officials, both at the local level and the state level, to start talking to the citizens instead of talking to each other.
We want to thank our partners in this effort, which include the Atlanta Medical Association, founded in 1890 because black doctors couldn't get admitted to practice in hospitals, the Georgia Stand Up, and the Georgia Coalition for People's Agenda. Thank you so much.